Hi everybody, my name is Jason. I am JT Barofka's father. JT has TPI deficiency, or another word is TPI disease. I'm making this video to show a time progression over amount of 6 years, 3 months. So I'm going to start at his day of birth all the way to now, which is December 11th, 2024. All right, day one. JT was born in Monterey, California, September 13th, 2018. Everything was fine. No complications at birth, no sign of anything. He didn't have a little bit of jaundice, but we were able to go home. All right, fast forward to 3 months checkup. His first real checkup with his pediatrician. This is where things started to show up. His iron levels were discovered to be extremely low. And the pediatrician recommended that we take him north up to Stanford Children's Hospital and get him tested immediately. As soon as we arrived at Stanford, they immediately did a blood test, and right away they discovered that his hemoglobin level was extremely low, around 4.0. Then JT was required to have an emergency blood transfusion, which we were stayed in the hospital for 2.5 days while they monitored him and tried to figure out what was causing it. After being in the hospital for 2.5 days, we were released, and the doctors said that JT had some form of hemolytic anemia. They just couldn't pinpoint it. They needed to do some more testing. So we took some tests, rescheduled more doctor appointments, and they continued to test for the next month. After the test results that they did came back with no information, Dr. Bertel Glader, which was a head hematologist of Stanford Children's, he pushed for a genetic panel test to be done for JT, but he said it would take months for results to come back. So we gave him the go-ahead to do that. All right, let's fast forward to JT is 6 months now. We got notified from the Stanford team of doctors that the test results had came back, and they wanted us to come up so they can discuss them with us in person. Shortly after arriving at Stanford Children's for that appointment, the doctors gave us the bad news that JT has TPI disease, and what he was given 3 years to live, possibly 5. The doctors also mentioned there was no treatment, there was nothing, but they were going to continue to search for anything that could possibly help JT. After returning home, it was about a month later, I would say month 7, that the doctors had reached out to a researcher by the name of Michael Palladino at the University of Pittsburgh, and he recommended that we place JT on a keto diet along with a concoction of vitamin compounds that could possibly slow down the progression of TPI in JT. Month 8 is my estimated time about when JT fully started the keto diet and the vitamin compounds to help boost his immune system, basically to slow down the progression. So yeah, it was month 8. All right, fast forward now to JT's getting a little older. Month 9, 10, 11, 12, we don't see any problems with JT other than the hemolytic anemia part, but he was growing up just like a normal kid, meeting all his goals as far as crawling, starting to talk, so on. JT was looking great. About 1 month after his first birthday, so month 13, JT caught his first major illness, and it was a major stomach virus. That is where we noticed maybe about 3 to 4 weeks after, we started to notice some things going wrong with JT. First, we noticed that JT's arm strength was getting a lot weaker, and as it progressed, we kind of noticed he was having some trouble sitting up and crawling. He wasn't doing as much, but he was still happy. He was still growing. Okay, the beginning of the 15th month, JT was doing very bad. His breathing was really off. He definitely lost weight. And we took him in. They did some x-rays on his lungs and more neurological testing. They told us that JT had some major lung paralysis. Basically, his lungs were paralyzed, and that he was relying on his muscles, chest muscles, shoulder muscles to breathe, and that was what was causing the massive weight loss. He was basically running a marathon. At that time, we scheduled a trach surgery and a G-tube surgery as well. Okay, it's mid-January. Just a couple weeks, fast forward, mid-January, it's 15 months. Mid-January, JT has his trach surgery. Everything went well, the trach and the G-tube surgery. When he came out of surgery, however, he was having some type of episodes where his muscles were really tensing up. He did spike a fever for a couple days. It was a little scary time. We were in the ICU for a month and a half before we were released. And JT also showed signs of some spasticity after the surgery. So we don't know if the surgery caused it. TPI progression is increasing. So yeah, we were in there for a month and a half, and then we were released. Okay, now after being home with JT on a trach and G-tube, and he's been on the keto diet now for some time. So we could fast forward all the way to July. So say 5 to 8 more months. We did notice that JT started to put on more weight, due possibly to the keto diet, but he started to put on more weight. His breathing was controlled by his ventilator, so he was starting to look a little more healthy. However, there was a few neurological symptoms that we started to really notice. Again, he was extremely weak. His legs were not as strong as they were. His arm movement started to get kind of restricted, and spasticity started to turn his arms in, especially one arm, and I can't remember which side it was at this time. Then we did notice his eyes were crossing slightly, so we did have his vision checked. And by the way, we have everything checked, vision, heart, all the time. So far, his vision and heart have been perfectly fine. Okay, 2.5 years. Around the 2.5 year mark, we decided to relocate to Dallas-Fort Worth area, Texas, and now he is going to Dallas Children's Hospital. JT is continuing to progress slowly. Speech is delayed speech for sure. Muscle tone wasn't looking so good, and he was really tight. However, his breathing seemed to be decent. He didn't require oxygen like he did before. He required some oxygen. Now he's not requiring oxygen, and he's breathing very well on his vent. Around year 4.5, we noticed that JT was having a hip dysplasia issue where he wasn't weight bearing. So one of his legs is slightly shorter now, currently now about 1.25 inches shorter than the other leg. Year 5, JT is continuing to be on a keto diet, take vitamin compound. JT, as breathing is improved, he's able to start to come off of the vent for a few hours a day, and he's also gaining a little bit of arm strength and arm movement. Doesn't look so tight and restricted. Now he's able to stretch his arms completely out. And also he is on some baclofen, basically some muscle relaxing drugs at night, so he can his muscles loosen up. So he seems to be, in a way, slightly improving. All right, so JT's 6 years old now. He's beating some odds. They told us he would never eat. He would never come off the vent. Now he's able to eat at least one meal a day, and he's off of the vent and capped all day. He only is on the ventilator when he's asleep at night. Hip dysplasia is still there, and he's starting to learn how to bear weight he has a whole bunch of physical therapy he goes through. So he has occupational therapy, physical therapy, and speech therapy all at once. He does have a speaking board, and we are seeing him actually learning how to talk with the speaking board and trying to vocalize as well. He also goes to school 2 days a week for 4.5 hours a day, and his teacher said he's doing very well. Even though he's delayed speech, he's a little delayed on learning, but he's all there. All right, so currently JT is stable. Let me just kind of go over the last 3 years of medical visits. He's had 5 blood transfusions when he got sick. Every time he has gotten sick, it kind of sets him back about a month or so, 2 months, and then he comes back. The last 2 times he was sick, he bounced right back real quickly. And since we've been in Texas, and anytime he does spike a fever or get sick, he is hospitalized up to 2 to 4 days. So we've came out of every situation, but JT is recovered just fine. He's currently being his happy little self, and we're happy the way things are going, and we are extremely excited to hear there is a possible drug that can help JT and help save his life. If you guys want to see any other videos or any fun stuff, that JT has a huge social media platform with tons of videos, him going to school, doing things with his friends, hard time doctor visits, you name it, it's all out there. So enjoy. Thank you very much. Let's find a cure. Save JT.